Break into the Women's Month with the best entertainment. Witness the best of football and great series on Topstar for as low as 135 kwacha Antenna Classic or 140 kwacha D-Smart. Start the month with the semi-finals of the Coppa Italia when AC Milan takes on Inter Milan in the Derby di Milano at 22 hours on 1st March on Wild Football. Then open your Match African football page and witness North Africa's best Al Ali of Egypt as they host El Merreikh of Sudan on Saturday 5th March at 21 hours on Wild Football, and catch all return leg games of the CAF Champions League and Confederation Cup. But guess what? Queen of Flow is back with even more suspense in Season 2. Follow the story of love, passion and rage every Saturday to Wednesday at 21:30 hours on Novella E+. So get yourself an antenna or dish decoder now to join the growing family of Topstar. Subscribe now. Topstar, affordable digital TV.
There cannot be universal health coverage without enhanced sexual reproductive health and rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, brings you Inside Health TV program, a program that promotes sexual reproductive health rights and also discusses various health issues affecting people from all walks of life. Join me, Tumenji Chinjili, every Sunday from 20 to 21 hours on KBN TV, DSTV channel 279 and Topstar 102. We'll also be live on Zago and KBN Facebook pages and YouTube channels. Tune in and share that health experience. Welcome to our 7th and the last episode of the Inside Health program right here at KBN Television. This is a program that has been designed to discuss a wide health issues that are affecting Zambians and beyond. This program is brought to you by the Zambia Association of Gynecologists and Obstetricians, ZAGO, with the support from the International Federation of Gynecology and Obstetrics, FIGO. For the past couple of months, ZAGO has been sharing with the general public various discussions highlighting solutions to major health problems affecting the country. Topics such as prevention of maternal deaths and morbidity, cervical cancer, unsafe abortions, unwanted or rather unplanned pregnancies are among other topics we have been discussing during this program. We are optimistic that our viewers have and will continue to learn more from these discussions even when the program series comes to a brief break. We are hopeful to resume as soon as possible. However, this evening, we are looking at yet another interesting topic, which is birth control and infertility. This is one of the most controversial of topics. There are so many myths and beliefs surrounding birth control, commonly known as contraception. While some people say women who use contraceptives to control reproductive system risks becoming barren, others say contraceptives causes other problems such as cervical cancer and breast cancer. There are also other claims suggesting that contraceptives reduce sexual desire in women, and many other myths that we hear of in our different communities. So this evening, we'll be discussing this very interesting topic, and I'm not alone in the studio today. I've been joined by Dr. Wyson. But before we go any further, please note that we are live on KBN TV page on Facebook and also Zago Facebook page, as well as our YouTube channels. We are there. You can join us and be part of this program. I'm your host, Tumenji Chinjili. Coming back to our topic, as I earlier stated, I've been joined by Dr. Wyson Munga, our very own. He's not coming for the first time to this program. Doc, good evening and welcome to the program.
Good evening to Tumenji and the viewers.
It's great to have you here again, Doc.
Thank you very much.
So, Doc, as you've heard the program, the title of the topic we are looking at today, we are looking at birth control and infertility. So just to get right straight into our discussion, Doc, what is birth control within the broader context of reproductive health?
Birth control or contraception is basically any method that sexual partners can use to prevent a pregnancy. as simple as that.
Any
method
method.
that can be used so that there's no pregnancy.
Okay. Based on your brief response that you've just given can we just zero it in details? What is contraception?
So, conceiving, the word conception comes from conceiving. Then contra is anything against. So anything against conceiving, anything that would be used, whatever method, as long as it will prevent conceiving, that's contraception. It's the same. I want to keep it as simple as that so that there are no misunderstandings.
Okay.
Mm-hmm.
So you, even in the first response you gave, you talked about the methods, and even this response you've just given, you've also talked about methods. So can we go in details? What methods are you referring to exactly?
Yeah, so there are various methods that sexual partners can use to prevent a pregnancy from resulting. Okay, so the first method I want to talk about is the traditional method. Traditional, okay? So there are many methods that are used there. Within the traditional, there are so many other different methods that are employed. So number one, there are other people that would simply use the calendar. The woman follows her menses so well that she knows when she's fertile. She knows when her egg is coming out.
That's a traditional method.
She knows that my egg will come out on these days for this month because she has mastered how long her cycle is. She has mastered her fertile days. Okay, either by using the clock, the calendar. Other women are so sensitive, they will even know the body changes that will be there. For example, the body temperature rises a bit, the breasts become a bit engorged and tender, even in the discharge from the private part, will be a bit increased and a bit slimy. So some women even just even if they forgot to look at the calendar, they will tell you that the way I'm feeling, I think I am on that time of the month where my eggs are coming out, I am fertile. So now, having known that, many things can be used, or many ways. Okay. So number one, they can avoid sexual contact during the fertile window. Okay. Okay. That's it, tradition. So remember, the very purpose is to prevent a pregnancy, to be against conception, to make sure conception doesn't take place. So they will avoid sexual contact during the fertile window. For others, they will even have sex, but when the man is about to ejaculate, to release his semen, the man comes out and releases outside. That's withdrawal method. You understand? What is the purpose? The purpose is that there should be no conception, contraception. That's traditional method. Okay. Then other than that, okay, so others can avoid the fertile, avoid sex totally during that window. Others will have but will withdraw and ejaculate maybe on the floor or wherever. Okay. The second method, okay, now we move from the traditional to the conventional methods. Conventional meaning these artificial things that have been made to make sure that if you do not want to conceive, it should not happen.
The modern.
Let's call them the modern or the artificial. Okay. So the first one in the artificial will be barrier method. Barrier is anything that can block, isn't it? So we are saying anything that can block the male seed, the sperms, from going all the way in the female system to go and meet the egg, isn't it? So what are some of the barrier methods? Number one, you can use condoms. Condom is simply a special plastic material that is designed to create a barrier, isn't it? So it's either the male condom that is worn by the male, so that when he ejaculates or releases the semen is contained and it doesn't go beyond the barrier of the plastic. You can also have the female condom, which is worn by the female person. They are all barriers. Other barriers would also include their cervical caps, caps that the woman wears inside and seals off the cervix so that the sperms will not go. The other barrier method can be just using chemicals that would kill the sperms when they are left in the woman's private part. Okay, they are called spermicides.
Okay.
They are chemicals that kill the sperms. All these are barriers. Now remember, whether someone is using natural, he withdraws or avoids, whether one has a plastic in between, the common purpose is that you don't want conception, contraception. I'll keep emphasizing on that.
Yes.
Now, the other method is the oral tablets. They are called contraceptive pills. They are also of two types.
Okay.
Yeah. So remember, the method is the same by drinking a tablet every day. And they work the same. Those contain hormones. The other ones contain two hormones. Okay? Estrogen and progesterone. These are the normal female hormones that a female in the reproductive age has.
Those are the oral contraceptives.
Yes. So one of the types of the oral contraceptives will have two hormones, estrogen and progesterone. Every woman in the reproductive age has got natural estrogen and progesterone. But the way it is that when you increase the estrogen in a lady in the reproductive age, it works backwards to prevent other hormones that causes the release of the eggs. So when you drink the contraceptives, the oral ones, the tablets, what you are doing is to prevent ovulation, to prevent release of the egg. So one type has got two hormones, estrogen and progesterone. The other type just has one hormone.
Okay.
So when you hear combined oral contraceptives, the combination is the two hormones, estrogen, progesterone. Then there's a single pill, meaning that there's just one hormone, progestogen, but they work the same way. They will work by preventing ovulation, which is release of the egg. Okay, so now that one, remember, you have to drink every day. Huh? Yeah, if you forget, you miss like 2-3 days, trouble, you need to use other extra methods, maybe a condom also, because you know. So I will explain later what influences the choice of each of the methods that you use. Is that okay? So you have oral tablets, combined or single. Then from there you have the injectables. The injectables means that this woman who does not want to conceive receives an injection, either every 2 months one injection or every 3 months one injection. You know how they work? The same way, because they are also hormones. They will prevent release of the egg. They will prevent ovulation. Okay. There are other things, of course. It can even close up the cervix by thickening the mucus there and thin the inner lining of the womb to make it very thin and so on. But the principal method of preventing a pregnancy is by preventing ovulation or release of the egg. So it's either you get a jab every 2 months or a jab in the muscles every 3 months. The other method is implant, meaning we plant a small plastic rods under the skin in the inner arm.
Oh, they are plastic.
Yes, they are plastic material, but special material with the hormones inside. So once we put them under the skin, then the hormones will be released slowly. If we put one rod, it's called implanon. It can work up to 3 years, protecting you. The other one is the Jadeo. How many rods? 2. That one now can extend to protect you from conceiving up to 5 years. Remember, they are also hormones. So the same way, they will prevent ovulation or release of the egg. Okay. You continue to have your peas, by the way, but you are not actually releasing your eggs. Your eggs are not coming out. Okay. The other method is the loop. The loop, there are two types. There's the one for the hormone again. The other one has got no hormones. Okay? So the one that has got hormones, it can protect you up to 5 years. So the loop is a small material that is inserted inside your womb so that it just sits inside your womb.
How comfortable is that?
It is comfortable. Okay? Yeah. So it is inside your womb. It sits inside your womb with two small soft strings that hang out of the cervix. They are made in such a way that they are not harmful and they will not even cause problems.
And they are not even felt.
You can feel them, but they will not hurt you or hurt your partner. Okay. Okay. So that one now can protect you for up to 5 years. How do they work? The same way, because they are hormones. They will prevent the release of the eggs or ovulation. Okay. Now, there's the non-hormonal. There are other women who say, I don't want extra hormones in my body, or I don't want chemicals in my body. Then you use a copper material, again inserted in the womb. Sperms do not survive in the environment where there's copper. So the sperms will be going in, but once they reach the inside of the womb, there's copper, and they all die. So you would have prevented conception, because conception, by the way, is where the sperm travels from the vagina all the way up to reach the tubes, the fallopian tubes. Then the egg is also coming from the ovaries, and they have to meet within the tube. So anything that will prevent the two from meeting, okay, the egg and the sperm, will be called contraception. Now, the copper one can actually prevent you from conceiving continuously up to 10, 12 years. Actually, let me limit it to 10 years for now, but it can even go beyond that. Okay? So now, when we say the copper can go up to 10 years or 12 years, we do not mean that once you put, you are doomed for 10 years. Once you want to conceive, you are ready, you have planned. You just remove it and return to fertility immediately.
Is that supposed to be done at a health facility, or it's...
Yes. Now, there are other methods where you can easily go in a pharmacy and buy, like the oral contraceptives, the what. But there are these methods like the injection, the implants, okay, the loop and so on. Those have to be inserted by people that are trained and qualified to conduct the procedure, so that you maximize on safety and correct insertion or correct injection, so that there are no complications associated with that. Okay, now there are other methods again which are permanent. All these are reversible, meaning when you want to conceive, you just withdraw the method. You have reversed the contraception.
Yes.
You want to conceive. There are now permanent methods, irreversible, meaning not reversible. Once you are decided, it means you are saying, I am done. So for the females, it's a minor operation where we go in with a small opening, and then we go and pick the left tube, tie it. Okay? Pick the nakamba right. Pick the left tube, now tie it, so that both tubes are tied. Okay. This is called bilateral tubal ligation. Remember, when you have tied and cut the tube, that's where the sperm and the egg are supposed to meet. It means the two can never meet. That's what we call bilateral tubal ligation. Bilateral meaning two sides, tubal meaning the tube. Ligation means being tied. Okay, that's it. You hear in the community that you are never pindamula chibaliro. It's not like getting a womb and turning it upside down. So it's simply tying the tube, both the tubes, the left and the right, so that you are done. When you are satisfied, you are saying, I am done with having children. For males also, there's a permanent method of contraception. And that method involves the tubes where the sperms pass through, okay? They are also tied. Okay. It's called vasectomy. so that also the man, when the man says, okay, my wife, I think we are done having children, but you've been to labor ward several times. Can I also do something about it? Then the man goes, and then his sperm tubes are tied. Then it is not reversible. These are the methods. Now, to Menchi and the viewers, each method has got a lot of information behind it. Okay. No wonder, no matter how simple the method is, though earlier I said other methods, you can go to a pharmacy. Please, it is always important to get contraception counseling from the providers that are trained. Okay? Why? Because there's a lot of information you need to know. You need to know, how does this method work? You need to know, how effective is this method? You need to know, what are the side effects? What are some of the effects that can happen? What can change when I start using this method? Okay, you need to know what is the failure rate? How much percentage of this is there a possibility of it failing? You need to know which methods cannot be put in you once you have certain other conditions, like high blood pressure, you have diabetes, sugar disease, or you have heart disease. So there are other methods that do not go well with other medical conditions. For example, when someone has got a heart disease, we will not give them anything containing estrogen, the hormone estrogen. If someone, for example, has high blood pressure, maybe even on BP medications, we will not give them these combined contraceptives, the combined hormones, the combined contraceptives. You understand? If someone is on certain medications, again, we know what to avoid. Yeah, so this is extremely important. If someone has got maybe repeated infections, pelvic infections, we will not put a rule because we can worsen the condition or make you know. So that's why before you get any method, have information. Where do you get the information? The providers. They are well trained to counsel you on all these various aspects of any method that you pick. And our role is to teach you about each of the methods in detail so that the one who makes the choice should be you after you are very well informed. When you go through the counseling process of contraception, you know what will happen to men. No, let me finish this one. Is that when you are equipped with the information you've been given through the counseling, it's unlikely that you'll be misled. It's unlikely that you will buy into the myths. It's unlikely that you are going to be the rumor monger in the community. It's unlikely that false information will spread about contraception.
So just on the myths, as you've already said. So there are fears suggesting that contraceptives, if used for a long time, can cause infertility in a woman. How true is that? Because those are the myths that we hear in our communities, in our different communities.
So that one categorically is not true. Okay. However, there are some methods like the injectables, like the one. There are these methods. If you choose the injectable for 3 months, after you stop using it, you may not conceive immediately. Maybe you take maybe 6 months to 1 year before you can conceive. Already, it means that there will be no room for that myth because so myths come as a result of information gaps. So where there's information gap, people always feed the gap up, whether with wrong information, and some people are brave, right? They just wake up to and they start telling the neighbor, I told you that you are not going to conceive because you use the contract. And they become like authorities. So when we share this information, pieces of information correctly, and we seek information from the correct people, you find that that myth is absolutely not correct. It is wrong, not true. If it had colors, we can say blue lie.
Okay, Doc. Interesting. Having mentioned of infertility, could you just explain to our viewers what do you mean exactly by infertility?
Infertility to men and the viewers is failure to achieve a conception, failure to make a pregnancy. Two people, male and female, they are having sex regularly, right? Regularly, without any barrier, without any protection, regularly, for a period of 1 full year, and then there's no pregnancy. Then we say there's a fertility problem. There is subfertility, there's infertility. Trying regularly, unprotected, unprotected, without using any contraception, regularly, for 1 year, no mimba, then we say there's infertility.
So it's 1 year. That's
Yes,
when you can.
that's the scientific mark that has been put for us before you said there's a problem.
Interesting. So, Doc, just like any other disease or health disorder, there are usually signs and symptoms before we conclude to say this person has this disorder. So, what are some of the signs and symptoms of infertility?
That one will not apply. It's just you have been having irregular sex. Okay. You are not using any contraception. For 1 year, there is no pregnancy. That's a sign enough that there should be a problem. Now remember, the problem can be both with the female or the male, because the community out there always blames the woman.
Exactly.
Our women are so disadvantaged. They walk with their faces down.
That's very
They
true.
are made to do wrong things. Okay, they jump from one place to another. They drink concoctions. They receive all sorts of prayers. The man is not even there. Can I tell you something? It takes a man and a woman to produce a pregnancy. The woman alone will not have a pregnancy. So 30% of the challenges to conceive of infertility, the problem is with the woman. About 30% of infertility problems, the problem is with the man. About 30 other percent of infertility problem, the problem is contributed by both. A problem on the female and a problem on the male.
Okay.
So it's almost equal. So when we are dealing with a couple that is faced with infertility, we want to attend to the both of them. For the woman, we want to check how is the womb. So we'll do a scan and so on and so forth. Is it okay? We want to check if the ovaries are working, are the hormones that are responsible for producing the eggs correct? Are the eggs coming out? Is she able to ovulate? We'll do a hormonal profile. We will profile the hormones that are responsible for female fertility. Then we also want to check, are the tubes open? Remember, we said the sperm and the egg need to meet where? In the tube. So we want to do a special X-rays called the hysterosalpingograph. Forget about the complicated word. Let's shorten it. HSG. It is simply helping us to see if the tubes are open or blocked. If they are blocked, then there will be no meeting of the sperm and the tube. Okay? So when we have looked at the womb for the woman, when we have also looked at the tubes, when we have also looked at the function of the ovaries, are they doing their job to release the egg? We will know. If the problem is with the female, we'll definitely know that the problem is the woman, she's not able to ovulate, or maybe the tubes are blocked, or maybe the womb, there are problems inside, maybe there are growths inside, or maybe the womb is even collapsed and and so on and so forth. Then for the male, we want to do semen analysis. How is the seed for this male? Does he produce enough volume of the semen? What about, is the semen alkaline? If there's acid in the semen, okay, we want to look, is the appearance normal? What about the thickness? Is it normal? You understand? What about the sperm count? Imagine in 1 ml of semen, 1 ml chap of semen, we are supposed to have more than 15 million sperm cells, sperms. Sperm is the actual seed.
Exactly.
Then per full ejaculation, per full release, we are supposed to have more than 40 million sperms. Yet other men you find there's zero. Good volumes of semen, but no sperm inside, no
Completely.
seed. Yes. So you will hear things like azoospermia, meaning there are no sperms at all in this semen. Or you hear oligospermia, meaning the sperm count is really reduced in this semen. You understand? Yeah, so those are the issues. Even beyond that, okay, you also want to look, okay, these sperms, what do they have normal shapes? A sperm is supposed to have a head, a middle piece, and a tail. Some you find they are just heads to mange without tails. How are they going to swim all the way to the tubes? Others, they are just tails. Others, middle pieces. Others, abnormalities all over. We also want to look, are these sperms swimming? If they are swimming, are they swimming forward, or are they going backward, or they are just in one place? Then you see, so we see a lot of things in the semen. We also want to look at this semen and say, is there infection? If there's infection in the semen, a lot of things will go wrong. Either the sperms won't survive for a long time, or they'll be clustering together instead of being free to swim. They'll be like lumping together, problems, okay? So when you come as a couple, we will investigate both male and female. And I can assure you that in more than 90% of the cases, we will know where the problem is. And when you come as a couple, you are counseled together, you get the information together, even your unit in tackling this problem becomes so solidified. Even your love grows.
Yes.
You are even able to bear with each other because you know it's confidential, only the two of us know. Not where the man is drinking there, then he's even telling his friends, my wife is not able to conceive. Can't it's the gentleman, maybe there are no sperms or it's blanks. You know what I mean?
Yes.
So we need to remove this myth that it is the female. Conception is two people, male and female. When you have such a problem, please, viewers, 1 year you are married, 1 year you are trying to achieve a pregnancy and there's zero. Don't wait for 10 years, don't wait for 5 years. After 1 year of trying, come to the facilities, to the doctors. They will help you to be investigated until we know where the problem is. So that when we start helping you, we help you specifically for the problem that you have.
Okay, interesting. So many are the times that we've attached, infertility, we've attached the feminine face there, when actually it affects both.
We must change our thinking, our understanding. But that's why such programs are key. Anyway, it's usually lack of information.
Exactly. So, Doc, there are two types of infertility that I've come across. That's primary and secondary infertility. What is the difference between the two?
English. Primary means from where you go. If you are a woman, you've never had a pregnancy. Secondary means primarily you were able to have, then secondarily you fail.
Okay.
So meaning from where you go, you've never conceived, you've been trying nothing, not even in history. Then you are a primary infertility. But sometimes you could have managed primarily to have a pregnancy, irrespective of the outcome, whether it was a miscarriage, whether you had a child or children. Then later on, you fail to conceive, you fail to achieve another pregnancy after 1 year of trying. Then it's secondary. So it's the same. Now remember that the causes of primary subfertility and the secondary are the same. So you'll be investigated the same way. There's nothing like, oh, no, I had 2 children from my first marriage. Now I'm in my second marriage. We've been married for 2 years. I can't conceive. The factors are the same. You will be investigated the same way. It means you are a secondary subfertility. Okay, then someone who come, who've been married for 5 years, we have not managed to conceive. We'll ask the lady, have you ever been pregnant? Forget about what happened to the pregnancy. Have you ever been pregnant? If she says no, then she's primary. The man will ask, have you ever impregnated any woman? Anyone besides this one? Even a rumor or history or whatever. If they say no, then it's primary. It means from where to go they have not been fertile. Yeah, secondary means where to go they were fertile, now the fertility has gone.
So talking about factors, you just mentioned there that there are factors that cause infertility. So how is age, because literature says age can also be a factor causing somebody's infertility. So how does age come in?
So Tunenji, the difference between male fertility and female fertility is that, and understand this very well, when a baby girl is born, they are born with the eggs already made.
Okay.
But those eggs will be immature in small sac-like materials. We call them follicles. Yeah, they will remain immature follicles until they reach puberty. So the number of eggs you are born with is fixed. You are born with the eggs fixed, but they are immature and kept in that form. When you reach puberty, every month that you have your peas or your menstruation, the follicles, the ones that contain the eggs, they are recruited every month, matured, and then they burst to release the eggs. You understand? So because you are born with a fixed number, it means the older you are growing and the more menses you are having, the more ovulation, the eggs are finishing.
Yeah, they're reducing.
By the time you reach age 44 to 45 or 46, all the eggs are finished. And you can't manufacture anymore. They are finished. So that's why we say female fertility reduces as the age advances. When you start reaching 35, your fertility is going down. Whereas more after 40 years, your fertility is going down. When we say that, we don't mean your sexual activity or whatever. We mean the eggs that you are born with. They are going to finish now. They are going to completion. By the time you reach age 44, 45, 46, all the eggs are finished. Even if you continue having your peas, it's not necessarily for ovulation, for fertility. You are just winding up the clock until you reach menopause. You understand?
But what about
so, for males, however,
before you go anywhere, what about women who conceive maybe at maybe 55 going up? I've also seen women who conceive maybe at 60. How is that possible?
Now, be careful. You ask them, how did you conceive? Most of them, they simply went to IVF. They did in vitro fertilization.
It wasn't natural.
So meaning they used it. Either maybe they went to remove their eggs when they were young, and they were frozen and kept in the egg bank at the fertility clinics. Okay? And then after they have grown, they simply went to get their eggs, and they are fertilized by the sperm and they are put inside them. Or they simply went to the IVF center and asked for donated eggs, and then fertilization is done outside in the lab. Then after fertilization in the lab, the fertilized egg is put in them. So there are very few people that will remain fertile after the age of 45. In life, there are always outliers. We can have 1 or 2 cases, maybe in 1,000, where they are 46, 47, and they fall pregnant. Ordinarily following the natural cycle, no. So don't be deceived. Yeah, so let the people also be truthful and encourage others that even beyond the age of natural fertility, there's artificial fertility, which is IVF. You can use your own eggs if at all you still have some reserves, or you had kept them. In our friends' societies, People are so busy, so the lady will be like, now it's career. I don't want to be disturbed by children until I reach the max. You know what they do? They go to the IVF center, donate their eggs, and they are kept frozen. Maybe when they are 50, that's when they say, now I want to start having children. I've reached the max of my career. And then they will get the frozen egg, okay? Get the sperm, inject it direct in the egg using a fine needle. And fertilization has taken place, not in the tube, the natural fallopian tube, but in the lab. And you observe this fertilized egg growing. After 2 days, 3 days, you get it and put it in the womb. And the woman goes there celebrating and dancing, I am pregnant. Then you, who has no information, you will think that it is normal to become pregnant at 60.
Interesting.
Okay.
So you were talking about how age can affect.
So the age, the best age to have children for a female person is the age of 21 up to 35. I know that science tells us 18 to, in fact, the very, very best is between 18 to 25 to start having. But because of careers and the change of environments, it's stretched. Even if you had 5 children, have them within a certain age limit. Maybe up to age of 35, you are done with your children, from 21 to 35. But because of careers and so on, you find other people start in their 30s. Be mindful that after 35, the fertility starts reducing a bit, especially after 40, because you are going towards your end of natural fertility after 40. Remember, we said usually 44, 45, 46, you are done, the eggs are finished. So women, be mindful that age comes with reduced fertility, and at a certain age, the fertility goes. But for males, even a 100-year-old man can impregnate a 24-year-old.
So age does not affect men?
No.
Not at all.
Of course, their performance will be affected in what other people would be interested in, but in terms of actual fertility,
it's just on the women. Interesting. Okay, so Doc, talking about the problems of infertility, especially in women, are there any medications that are used to treat infertility?
So remember, I said when we investigate, when we do the investigations for both male and female, the results will tell us where the problem is. So the treatment is treating the problem that has been discovered after you finish all the investigations. So for example, if the problem is with ovulation, the release of the eggs, there are medications that promote ovulation. Yeah, so they are given, and there you are, if it is the only problem. If the problem is, for example, with the tubes being blocked, what do? You can either do an operation to unblock the tubes, it's called tuboplasty, or you can flush the tubes with a concoction of medicines called hydrotubation. Okay? Or depending on the blockage, others are too blocked even to be flushed or to be operated on. Then they are advised that the only way you can conceive is by having artificial fertilization in the IVF.
So when you talk about blockages, what do you mean exactly? What kind of blockages are there?
So the tube can block at the very end of the tube, or in the middle, or at the beginning of the tube where it is just coming from the uterus. The blockages that are just coming from the uterus, they are very tricky, but those at the end, you can even do an operation to just open that blockage at the end. And then it also depends on what is causing the blockage. For others, for example, you find the blockage is caused by pressure on the tubes, by maybe fibroids. You do an operation to remove the fibroids, the tubes are free and open. and fertility is there. So if it's the male, for example, after investigating, you find that maybe it's the sperm count which is low. There are medicines that are there to boost the sperm count, you see. So now you cannot treat blindly. That's the take-home message. Do not treat blindly, because the possible causes at various levels, you will never know where the problem is if you are not investigated. So we have seen people that have taken concoctions.
Exactly.
Like, I've taken ovulation tablets. So what? Do you know if your tubes are blocked? You can drink the whole pharmacy of ovulation tablets. All your eggs can come out at once, but if the tubes are blocked, you've just wasted your eggs.
And also traditional concoctions, yes.
My dear, you understand? So please, no guesswork, no dreaming, no trials. Just be investigated. The results will tell you it's the tube where there's problem, or it's ovulation, the eggs are not coming out, or it's the sperms that are actually very low, or what. Then you are treated accordingly, you are helped accordingly. And once you go through this process, even as a couple, your mindset and the positivity changes, and it grows so high, because you are taking this medicine all knowing that it's sorting out the problem that we found out, and conception easily comes.
Interesting. So, Doc, many times sterilization is usually mistaken for infertility, especially in men. What's the difference between the two? Could you just explain to our viewers so that we get the right information?
Sterilization is we are just complicating the English to mention. Sterilization means permanent contraception. What's it? Yes, so being sterile means you are not able to conceive, or you are not, if you are a woman, or you are not able to impregnate if you are a male, because of something that was done to make you not to conceive. So we said for females is BTL, bilateral tubal ligation, and for males is vasectomy, the tying of the tubes that carry the sperms. So sterilization is simply another word for the permanent methods of conception, the irreversible ones. So you say, oh, I want to be sterilized. You are simply saying, I want to use a method that will make me not able to conceive again.
Not that somebody is infertile.
No, but remember, by you to reach a stage where you are saying, I want to use a permanent method, it means you do not want to have children. So I will not group you to be infertile. Remember, we said infertility is when two people are trying to go, the aim is to conceive, but one way it's not happening. When you have done a permanent irreversible method of contraception, are you trying? Are you aiming at conceiving? No. So you will not be categorized as such, because that's not your aim. In fact, deliberately you even blocked yourselves from having such issues.
So are there any instances where somebody has been treated for infertility? They conceive, they have the child. Then later on, it so happens that they cannot have a child again. Maybe we call it secondary infertility, as you say.
So remember, I can have 10 children today, and I want to have the 11th ones. I fail, because these problems can come in at any point. Your tubes can be open, then later on there's a problem and they close. So secondary infertility can come in at any point. Whether you used the contraception, whether you were treated for fertility or not treated, it can always come to anybody. So I want to speak to those couples. Sometimes you find the woman is married, then she says, the problem is with me. My husband had 4 children from the other wife. Please, he can also have secondary infertility, can have the problems coming later, even after having those 4 children. So do not condemn yourself. Come as a couple. Okay? And other men are just busy keeping other women's children. You find the woman is coming alone. Where's your husband? No, I thought he shouldn't come because him actually last year he had a baby he went outside and had a baby. Are you sure it is his baby? We need to look at his semen. We need to investigate him. Other men have found solace in keeping other men's children and torturing the wives that they are the ones not conceiving, that the wives are not conceiving. Them baendauko babana mizira, they just women can also be tricky sometimes. So please, let's avoid these complications. Remember, it takes two. It doesn't matter whether you have children, they have children, or there's rumor as a children a child in the neighborhood. When the two of you are aiming, we take it as one aim. You and your husband come together, investigate it together. We know, oh, your husband is fine. Your problem is this, but we have this solution.
Okay. So are these services available at any, or rather all the health facilities in the country, or we have specific?
The information can be available across the country, but the investigations may be limited to facilities that are able to do, for example, check the hormones, okay? Check the HSG that have got X-rays to do HSG, and also the people to conduct the same procedure. So I would say the information is readily available, but in terms of doing full screening, do not worry. You may start at a clinic, then they tell you are not able to check the tubes here, we'll send you to a first level hospital. Please go. There are other issues also. The first level may say, okay, maybe here, we end here. We'll send you maybe to a higher level. Maybe you are seen by specialists, the gynecologists and obstetricians, and then you go there. Sometimes you come even to the gynecologist obstetricians, they will tell you maybe after investigating, the results show that it's not actually possible for natural conception. Then they will tell you that here we do not have the IVF services, but go to the IVF center. So there's a referral system. Every level knows what they are able to do and their limitations, and they'll always send you to the next level until your problem is sorted out. So let us not shy visiting the health facility.
Okay. So as we're about to come to the close of the program, what is ZAGO doing to address the problem of infertility?
Well, I think the most important thing is to have widespread dissemination of information, like we are doing. We are reaching out to great masses, and these programs are not just with KPN. They've been with ZNBC, they've been radio programs, they've been, and so on and so forth. I think beyond that, okay, ZAGO is also promoting, and it coordinates very well, promoting the training of specialists in gyne and obstetricians, because the more gynecologists you have and the obstetricians, the more these issues will easily be spread out in terms of what help the people can receive. For example, previously they were just used to be obstetricians just on the Copper Belt, in Lusaka and Copper Belt and probably Southern Province and Eastern. But now we have obstetricians almost in each and every provincial hospital. You understand? Now imagine if we continued on this trajectory, promoting and encouraging people to do obs and gyne, to do career development and career building, so that the young doctors can also specialize in gyne. Then we'll have obstetricians almost in every district. That is the aim. Number two, ZAGO continues to lobby for advancements in the obstetric and gynecological care, so that facilities such as the ability, X-rays, for example, to check the tubes, okay, for example, labs that are able to check the hormones, for example, IVF centers that can be accessible in terms of distance and the price. Then that is the way to go as a country. So ZAGO's responsibility is to keep lobbying for quality and improved care of gynecological services in the country and beyond. I wanted to talk also about, And then the more we disseminate this information, it becomes very easy for people to avoid myths and get information from the correct places, and to make sure that, people have access. The most important thing is access to information, access to services. I pray that as we go forward and continue with our quest or with our endeavors as Zago to keep on this trajectory, we can work together with all key stakeholders, the community, the media, everyone else, the women lobby groups. Please, we are there for the woman.
Okay. Now, in a minute, Doc, or less than a minute, what are your concluding remarks?
My concluding remarks are: number one, contraception. Please, go to a health facility. There are always MCH or contraception, family planning units. Get the correct information than relying on myths. You will be misled. Okay? There are a lot of myths. For example, like the one you said, contraception can make you infertile, can cause infertility. Absolutely wrong. Wrong usage of contraception also has created a lot of problems. Okay, you find, for example, the emergency pill, which is supposed to be used one-off in life when it's really an emergency. People want to use it as routine. Then it even disturbs their menses and so on, their hormones. Please don't get the correct information. If you don't have information, you use it wrongly. Even a condom, you need to be taught how to use it. People do not know how to use condoms. Okay? They don't know how to wear it. You find women come back complaining it has fallen inside. The ring has fallen inside. I can't see it. You need now to start retrieving it. The males who come complaining it best, it's because they did not wear it properly. Maybe they did not store it correctly. You understand? There are all these myths like, it can cause cervical cancer. Wrong information. Okay, and so on and so forth. What am I saying? When you have a healthy issue, especially our women, do not sit in women clubs and gatherings and start lying to each other. As a woman on your own, tell your gatherings that me, I will not get reliable information from this gathering or club. I will go to a family planning unit, get the correct information. About fertility, I will not be drinking concoctions alone because I don't become pregnant alone. I will carry my husband hand in hand, walk into a health facility and present our challenge. Let them look at the both of us until the problem is found. So that when we are helped in complete terms, and we have all the information, and we sleep well. We don't suspect each other like my friend doesn't conceive. Maybe it's him. No, I heard a rumor he impregnated a girl 5 years ago. Please, let's attend to these issues as advised on this program. Thank you.
Thank you so much, Doc, for having made it to the program, and of course, for giving us a deeper understanding on birth control and infertility. I'm sure our viewers have learned one or two things. Thank you so much.
Thank you.
To our esteemed viewers, we have come to the end of today's program, where we're looking at birth control and infertility. I hope you have learned a lot from what Dr. Munga here was explaining during the discussion. This is the last episode in the series. I wish to state that the program will be back as soon as possible. Thank you so much for partnering with us, for being part of this program. And to our KBN team, we thank you for partnering with Zago. And I can assure you that the partnership will last a test of time. In the meantime, the conversation can continue on our social media pages, which is KBN TV on Facebook, Zago Facebook page, as well as on our YouTube channels, which is KBN TV and Zago. Till then, I was your host, and I'll still be your host, Tumenji Chinjili. Thank you and have a lovely evening.
It is said there cannot be universal health coverage without enhanced sexual reproductive health and rights. This is why the Zambia Association of Gynecologists and Obstetricians, ZAGO, brings you Inside Health TV program, a program that promotes sexual reproductive health rights and also discusses various health issues affecting people from all walks of life. Join me, Tumenje Chinjili, every Sunday from 20 to 21 hours on KBN TV, DSTV channel 279 and Topstar 102. We'll also be live on Zago and KBN Facebook pages and YouTube channels.